topic is test for detection of ketone bodies in urine. Okay. So in a normal urine sample, in a healthy person can excrete about 20 milligram of 20 milligram of ketone bodies per day in 24 hours. This is the normal value. So in case of starvation or in case of uncontrolled diabetes mellitus, what happens is the ketone bodies are present more than the normal value. So suppose maybe you have heard Bhukh Hartal. Some people are going into starvation, not eating for puja or whatever we do starvation. So how can you say that a person is actually starving or they are actually hiding and saying that they are starving?
By testing their urine.
Yes, exactly, by testing their urine sample. What will it show? Ketone bodies. And why?
Because
body uses ketone in the absence of fats and carbs.
Exactly. So what happens in case of uncontrolled diabetes mellitus or starvation? You are not taking anything, right? You are not providing sugar in your body. So what your body does for energy production, it utilizes the stored fat from your body. In that process, what is ketone body? It is a byproduct of the fat metabolism. So in that process, there is more amount of ketone bodies into your body. So when it comes out in your when the excess amount of fat is metabolized, then in case of uncontrolled diabetes or starvation, there will be overproduction of acetoacetate, which is a byproduct of the fat metabolism. Now in your body, you have a limited amount of oxygen supply. So this excess, all the excess amount of the byproduct of the fat metabolism, everything will not be decarboxylated. Okay, a portion will be decarboxylated and the remaining portion, they'll come out in your blood as acetoacetate or beta hydroxybutyric acid. Did you get the logic of how ketone bodies appear? This is what happens. This is why ketone bodies are more in case of starvation and diabetes mellitus. What happens in diabetes? There is no insulin. So the food the patient is taking, it is not going to get digested, it is not going to get metabolized. So the body, what it does? It metabolizes the fat. And that is why in diabetic patients, the ketone bodies are more. Okay? So there are two tests that can detect the presence of ketone bodies in the urine. Number one is the Rothera's test and number two, Gerhardt's test. You are going to perform the Rothera's test in your lab today. Okay? So there are three types of ketone bodies. They are acetone, acetoacetate and beta hydroxybutyrate. So just because you are not going to perform Gerhardt's, that doesn't mean that you don't have to know about it. If you got a urine sample during your practical, if you are yawning, drink water. If you are sleepy. So suppose you got a urine sample which is positive for ketone bodies. So the teacher, the external might ask you, what is the other test that can give that we can perform? Then you have to know some things about Gerhardt's also, the principle and drawbacks and all that. So in Gerhardt's test, we take around 3 to 5 ml of urine sample. Okay, in that we add 10% ferric chloride, which gives us a Bordeaux red color. After that, we boil it for 5 minutes, which gives and if we see that the color disappears, it is presence of acetoacetic acid. Okay, that is the acetone. It is the acetoacetic, presence of acetoacetic acid. And if the color persists, it means the absence of acetoacetic acid and presence of salicylates. So this is how we do it and we can find out if it is present or not. But the question is why we don't perform the test. It is because the drawback of this test is only for the detection of the acetoacetic acid. It will not show you the presence of acetone. This is the drawback and this is why we don't do it. But in Rotheras, you will get the presence of both acetone and acetoacetic acid. So this is one of the drawback, and you might get a question why we don't do it. Okay.
Ma'am, the urine sample will take 3 to 5 minutes.
Huh?
Urine sample?
Yes, 3 to 5. Done? What? No, this is just for explaining. Just for understanding, for explaining. I'm changing. So this is our topic proper, Rothera's test. The principle of this test is alkaline nitroprusside reacts with the keto group of acetone and acetoacetate to create a purple colored complex. This test is used to detect the presence of acetone or acetoacetate in urine. As I said, Rothera's gives us positive for acetone and acetoacetate. I'm repeating the principle again. The principle of this test is alkaline nitroprusside reacts with the keto group of acetone and acetoacetate to create a purple color complex. This test is used to detect the presence of acetone or acetoacetate in urine. Now there is another byproduct as well of the fat metabolism, that is the beta hydroxybutyrate. But the Rothera's does not show beta hydroxybutyrate presence, but it is a major constituent of the ketone body in the plasma and urine. See, read this line. Beta hydroxybutyrate did not show positive result to this test, even though it is positive of the major constituents of ketone body in plasma and urine. Why? Any idea? This is because the keto group is not present in beta hydroxybutyrate. It has the hydroxyl group. This is the reason why it does not show positive. But advanced Rothera's tests show positive for beta hydroxybutyrate. Okay? Should I change? So these are the reagents. Ammonium sulfate crystals. This is ammonium sulfate crystals. Everybody can see? Then we have 2% sodium nitroprusside. Can see? Then we have liquor ammonia. These are the reagents. Okay? Now the function of ammonia sulfate crystals is it precipitates the protein and other impurities in the sample and makes the sample clear for reaction. Now your urine sample can have other things also. It can have protein or any impurities that can come out through your urine. It can have glucose as well. So this ammonium sulfate crystals, it precipitates the rest and makes the urine sample clear for reaction to take place. This is the function. 2% sodium nitroprusside dissociates into sodium nitroferricyanide, which reacts with ketones and forms the purple ring. And liquor ammonia makes the medium alkaline for the reaction to take place. So these are the functions of all the reagents. I'll be asking questions in the end of the class. So please concentrate. Done? I'm changing, okay? So this is the procedure. Take 5 ml of urine sample in a test tube. Saturate the urine sample with ammonium sulfate crystals. Add 2 drops of freshly prepared 2% sodium nitroprusside solution to it and shake it well. Add 1 ml of liquor ammonia by the side of the test tube. Now I am going to perform and show it, okay? Don't hold it without a holder, but I don't have a holder, that is why I am holding it with my hand. But inside you hold it with a holder only. 5 ml of urine sample. Okay. Can you see? We'll add ammonium sulfate crystals. We'll add a pinch of it. Okay. Then 2 drops of
Sodium
2 to 3 drops you can put. Then no, you have to shake it. Yeah. After that 1 ml of how? By the side. That is very important. Okay, by the side, slowly by the side, like this. Can you see it now? Purple color. See? Back people might not be able to see. Can you see? So? Okay? The back people saw?
Yes.
So this is how you will do it. When you will go in the lab and you are assigned your stations, don't go there and stand blank and like, what is what? Don't be like that, okay? Now I performed it in front of you. You understood how to do it. Don't be blank and be asking us, madam, what to do, what to do. Don't be like that, okay?
What is freshly prepared solution?
Freshly, which one? This one.
You have to prepare it.
No, you don't have to prepare it. Mane, you have to take this 2 drops of this sodium nitroprusside. 2% sodium nitroprusside. You don't have to prepare it. Everything is there. You just have to perform the test. Okay? So the observation is a purple color ring is seen at the junction of both the liquids. A purple color ring is seen at the junction of both the liquids. The junction is between the urine sample and the liquor ammonia that I have added in my last step. A purple colored ring will be seen. Now, appearance of this purple colored ring indicates presence of acetone or acetoacetate in the urine. Sodium nitroprusside reacts with ketones to form a purple color complex in the alkaline medium provided by ammonia. Did you understand this line? Sodium nitroprusside reacts with ketones to form a purple color ring in the alkaline medium provided by ammonia. See, I saturated the urine sample with ammonium sulfate crystals, means all the rest of the things, whatever were there, proteins or any other things, I have cleared it out for the ketone bodies to react. After that, I added 2 drops of sodium nitroprusside solution and I shaked it well. So this, in the presence of alkaline medium provided by the liquor ammonia, caused the purple color complex. Are you getting what I am trying to say?
Yes, ma'am.
See, in this slide you will understand. See, what are the functions? It precipitates ammonia sulfate crystals, precipitates the rest of the impurities of the sample. Okay. Sodium nitroprusside dissociates into sodium nitroferricyanide, which reacts with the ketones to form a purple color ring in the presence of the alkaline medium, which is done by the liquor ammonia. So that is how you are getting the purple color ring. Now this test is very specific but not very sensitive. Do you understand what it means? Yeah, tell. She said yes. What do you understand? What do you understand by specific? Anything particular? It means this test is
Specific for ketone.
exactly. This test is specific for detection of ketone bodies. Okay, but not very sensitive. It has low sensitivity. What was the normal range of ketone bodies in a normal healthy person? 20. So suppose if you performed a test and you saw that it came positive. What does it mean? Positive for ketone bodies. Ketone bodies are present. But suppose the test came negative. So does it mean ketone bodies are not present?
Less.
Exactly. Traceable amount are there, but you cannot find it out with this test. So this is one of the drawbacks of this Rothera's. False positive test is possible if urine contains levodopa or phenyl pyruvate. So these two, if there is present, if the person is taking, suppose if the person is suffering from Parkinsonism, in that case we give levodopa medicine. It's a medication. So in that case, the sample of that patient can give false positive for ketone bodies. Which one? That false positive test is possible if urine contains levodopa or phenyl pyruvate. Levodopa is a drug we give in Parkinsonism treatment for Parkinsonism. So if the patient from whom you took the sample and you tested Rothera's, so that can give you false positive because the patient is taking levodopa. So this is a lab report, and this is, I did not make it, this is actually a lab report I collected of a patient. Okay, so this is how a lab report will look like. A urine REME, have you ever seen a patient or relative been advised for urine REME? No, never. Urine culture. So now you're doctors, so you will get your relatives coming to you and saying, see what this is a lab report of my urine test or my blood test. Can you please explain what it is? So you cannot show your blank faces there. You cannot be alienated to it. Whatever you are learning here, there is a clinical appliance, right? So for this particular patient, she is a 60-year-old lady. Listen, the history is very important. She is a 60-year-old female. She came into the emergency with complaint of shortness of breath, SOB. Okay, and her complaint was also decreased urine output since 2-3 days. She is a known case of diabetes, hypertension, and chronic kidney disease under medical management. Okay, this is the history. Now she is not under dialysis. She is chronic kidney disease patient, but she is not under dialysis, under medical management. So see this report, and so far whatever you have been taught, try to tell me the abnormalities. If you can find anything.
Transparency.
Negative means normal only. Try to find the abnormality, whatever you came across. What is urine ketone? Positive or negative? Negative. Negative means chhod do. Come down, see the microscopic examination.
Ma'am, can you please zoom it?
I can't zoom it. Who asked me to zoom it? Come here, come in front, give it a try, come. If you can't see, it's okay, come here. Anything? Did you come up with anything? Yes, right? এটা পরে কমায় দিতে লাগবে কিন্তু কোনটা আচ্ছা 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 now can you see yes the last yes you can you come up with any diagnosis you are not being able to see yes what pus cells exactly some infection so I'm explaining it yes he is right some infection is there so you see the okay now let me say you here see so the transparency and the deposit transparency is slightly hazy and deposits are also present okay I'm explaining now the thing is patient is a CKD patient I gave the history CKD patient so what are her kidneys functioning properly no will it be able to absorb back things no it's coming out many byproducts are coming out as itself so it will the transparency is slightly hazy and that's why sorry that the transparency is slightly hazy and as well as deposits are there maybe proteins are there okay because the kidneys are not being able to absorb the protein okay you got the explanation next in chemical examination the pH is 5 normal is 4.5 to 8 that's normal okay specific gravity is 1.010 and normal is 1.010 to 1.030 now tell me what is that this is normal specific gravity according to the report but what is the condition huh yes there is a specific term sir has taught you during specific gravity class isosthenuria remember this 1.010 this is a typical this will be typically seen in CKD patients the urine specific gravity will be 1.010 and typically seen in CKD patients okay so this is isosthenuria this is known as isosthenuria so then the urine glucose is negative because as I said the patient is diabetic but she is under medication so she is taking her medicine properly that's why no glucose in the urine now urine protein is positive why because she is a CKD patient her kidneys are not functioning nephrons are not being able to reabsorb the protein it's coming out with the urine then urine ketones are negative there are no ketones can be so then coming to microscopic examination as the pus cells are 25 to 30 as somebody said infection yes it's right pus cells are what dead that means there is an infection in the body your W blood cells yes white blood cells are fighting against it and that's why they are dying and coming out with the urine as well as the epithelial cells are 6 to 8 normal is 0 to 4 there is some maybe inflammation in the kidney that's why the mucosal layer is coming out getting eroded and coming out with the urine so seeing the microscopy examination report you can say that yeah she's having some infection now what causes infection organism will only cause the infection as this lady has said that she's having urinary tract infection yes the patient was having urinary tract infection but we cannot just say that seeing the microscopic report you will have an idea that yes she's having an infection but for the specification of the organism you advise for a urine culture that's where you'll understand now the patient has to do a urine culture okay so this is urine REME that is urine routine examination and microscopic examination got it so some terminologies ketonemia ketonuria and ketosis first understand then note it down listen to me you will get many terminologies like this okay many in your during your studies just understand break the words and first understand the logic anything that ends with anemia okay that is what no anything that ends with EMIA EMIA okay EMIA means involvement No. Anything that ends with emia means in the blood. Okay. It is presence of something in the blood. Okay. Anything that has urea means it is present in the urine. And anything that has SIS means systemic involvement. Okay, so this is break the words, you will get it. How much will you buy heart? There are so many things you will have to learn. Understand the logic. That will make it easy to, learn or whatever by heart. So ketonemia is saturation of extrahepatic machinery due to overproduction of ketone bodies leads to increased blood level of ketone bodies. Ketonuria is excretion of ketone bodies due to ketonemia is called ketonuria. Now this ketonemia and ketonuria will cause ketosis. That means your blood and urine is having ketone bodies which will ultimately affect your system. The system means the whole body. System is not any particular organ, means the whole body. Like in case of diabetes mellitus is a systemic disease. If you have diabetes mellitus, it can affect anything, your eye, your brain, anything can be affected. So this ketonemia and ketonuria causes ketosis, that is the excess formation of ketone bodies resulting in ketonemia and ketonuria causes ketosis, which is seen in uncontrolled diabetes mellitus, prolonged starvation and toxemia of pregnancy. Now you can note it. Toxemia of pregnancy means, suppose a lady, she got pregnant. She never had diabetes, but during pregnancy she developed gestational diabetes. That happens. Only during her pregnancy, during the course of pregnancy, she developed gestational diabetes. She can develop hypertension also. Uncontrolled. Control means you are providing insulin and you are trying to keep it into the normal range. When a patient is diagnosed with diabetes, what do we do? First we give oral medication. Then if it is not controlled with the oral medication, with lifestyle changes, we first advise for lifestyle changes. Okay, to avoid certain food, sweets and all that. After that we start with medications and after that we give insulin. But with insulin also you cannot control. After a certain time, after a certain period of time, insulin also cannot control the glucose level of the patient, that is uncontrolled. Diabetes, you cannot, it's not like fever that it will end or you cannot just finish the disease. You have to keep it under control, just like hypertension. You cannot, if a person is diagnosed with hypertension, you cannot just eradicate it from the person. It will be there, but you just have to keep it under control with medication. So that is toxemia of pregnancy means if a lady got pregnant and she never had diabetes, but during the course of her pregnancy she developed diabetes. Okay, she can develop hypertension as well, but she never had hypertension before. Extrahepatic machinery means, see, for that you have to read more. How to explain now? Not kidney, this is the liver, hepatic, this one, circulation, blood circulation, you have to know that first. Portal circulation, you have to know all those things in the liver, you have to know that. So a clinical case, please pay attention. Suppose during your clinical posting, you are in emergency, okay? During your internship, you are in emergency. You saw a 15-year-old boy is brought to emergency unit in a comatose condition. Please pay attention to each and every word. You will get the diagnosis. A 15-year-old boy is brought to emergency unit in a comatose condition. He is a known case of diabetes since 5 years. on irregular insulin treatment. Previous year, he had an episode of loss of consciousness while playing, for which he was treated with glucose and he recovered. On examination, his palm was cold and his breath was having fruity or sweet odor. Pulse rate was 120 per minute and respiration was fast and shallow, means like this, fast and shallow, not deep breaths, very shallow breaths but very fast. So you did some laboratory test and you found that the random blood sugar was 512, pH of blood was 7.05 and normal blood pH is 7.35 to 7.45. And in urine you saw that protein was absent, ketone bodies are 4 plus and sugar is also 4 plus. The diagnosis is DKA, diabetic ketoacidosis. I gave the diagnosis, now you tell me why it is DKA. Okay, one by one, don't shout. Someone please stand up and say, whoever. Okay, yeah, you tell me, stand up and tell me. Yes. Stand up and say.
And the blood sugar level here is high. And the protein reabsorption does not take place, so it is absent there. Ketone body is...
What protein?
Absorption of protein does not take place.
हाँ हाँ, तो इसलिए प्रोटीन रीएब्सॉर्ब नहीं हो रहा है तो यूरिन के साथ निकलेगा ना, तो ये तो एब्सेंट है.
अच्छा, ओके, एब्सेंट है.
हाँ, that means the proteins are getting absorbed, the kidneys are fine. हाँ.
Blood sugar level high और ketone bodies भी high है.
High है, but I am saying the diagnosis is DKA. I gave the diagnosis. Now tell me why DKA.
pH of blood is pH of lesser, so it is acidic. That's why acidosis, and presence of sugar, that's why diabetic, and presence of ketone bodies, that's why.
Exactly. Diabetic ketoacidosis. Diabetic because his sugar is more, 512. Ketone bodies are what? 4 plus. Acidosis because blood is what? pH of the blood is 7.05. That's why acidosis. So diabetic ketoacidosis. Okay? Yeah, I'll come to that. Okay, you got it? Now I have a question is, if suppose the pH of the patient was 7.38, then would it be acidic? No? What would it be? 7.38? 7.38 if the pH of the blood was 7.38. Not this, I'm just asking you. Then, why?
Because pH is in the normal.
No, see. Listen to me. The pH here is 7.35 to 7.45. Nobody can have an accurate pH like the normal pH. If you ask, then it is 7.4. Anything less than that is acidic, anything more than that is basic. But nobody can have a 7.4 pH. Nobody will have it. That is why we give a range. You understand? That is why we give a range. So if it is 7.38, means it is acidic only. It's not 7.4, na? This is the average value. Nobody can have a specific value that if you don't have, suppose he doesn't have 7.4, doesn't mean that he is not normal. It's normal. The body copes up in that case. But if there is a vast difference, then the acidic, the basic thing comes. And that is why we have an average value. Nobody will have 7.4.
So now if the pH was 7.38, then the word acidosis will not
that I am just asking you, just making you understand that the normal pH, if you say theoretically it is 7.4, but nobody here will have 7. The space hardly one will have. That is also doubtful. That is why we keep a range. Anything less than 7 is acidic, more than 7 is basic. That is why we keep a range.
diagnosis same
Diagnosis is same. DKA, yes. DKA I explained why. Because sugar is high, that is why diabetic. Ketone bodies are present, 4 plus. And acidosis because the blood is what? Acidic, that's why. Okay? Now dry chemistry. What is dry chemistry? What is dry chemistry? You tell me what is dry chemistry. Stand up. Do you know what is dry chemistry? You tell me what is dry chemistry. Excuse me, sir. What is dry chemistry? Sit down. Why are you reading here? I haven't defined what is dry chemistry. What is dry chemistry? Anyone?
Chemistry
With no water.
Huh?
With no water.
With no water. Chemistry without water is dry chemistry. Where we don't need chemicals, where we don't have to perform with chemicals, heating and all that. Sit down. Where we don't have to heat it, we don't have to use chemicals, reagents, that is dry chemistry. So, urinary ketone bodies can be measured with dipstick test, and the values are expressed as 1 plus, 2 plus, 3 plus, 4 plus. Now you understand 4 plus from where it came with the dipstick test. This is what it looks like. Did you do dipstick pH in your class 12? You did not? Litmus paper? Did not. So this is what it looks like. You can do dipstick for glucose also, protein also, and ketone bodies also. The color coding are different. Okay, so in the other, in my clinical case, ketone bodies were plus, right? We did the dipstick test because in the emergency the patient came. You cannot say, wait, give me your urine sample, let me perform Rotheras. No time for that. Patient is in comatose position. We do the dipstick test there in these cases. In emergencies, we do the dipstick test for the fast result. And this dipstick test is done in the big tertiary hospital setups, okay, not in periphery levels. In periphery levels, suppose somebody is posted in very deep, village of Rajasthan, you will not have dipstick there. You have to do the Rotheras only over there. That is why you should know how to do it. And in big hospitals, they do the dipstick test because the result is fast and it gives you a approximation value. This plus there are some values with it, how much can be present, some estimation values are, approximate values are there. But in Rotheras, will you get the approximate values? It will just tell you whether it is present or not, absent or present. So this is also another positive drawback as well, right? So the dipstick is coated with chemicals that reacts with ketones such as sodium nitroferricyanide and glycine. The color coatings in the dipstick strip are coated with sodium nitroferricyanide and glycine, which reacts with the urine sample and gives you the result. If it is deep purple means ketone bodies are present. Presence of ketone bodies in urine can also be due to toxemia of pregnancy and can also be due to high intake of fat and low carbohydrate diet. Why ketone bodies are more in this high intake of fat? Byproduct, exactly. And in low carbohydrate diet? You, that guy, yeah, tell me. Stand up and tell me. No, that guy behind you. Yeah. Tell me why ketone bodies are more in a low carbohydrate diet.
Because fat is burned, fat burned, converted to ketone bodies and urine bypasses to urine. That's why ketone bodies are high in fastings.
That is high in fastings. But that was not my question. In low carbohydrate diet. Your answer is correct if I would have said why the ketone bodies are more during fasting. But I said the patient is taking low carbohydrate diet now. This keto diet is there. Keto diet, sit down. Keto diet, you all have maybe heard keto diet and all the athletes they do, where they take less carbs, less water for their build and whatsoever. So what happens? You are not taking more amount of sugar. Not taking more amount of sugar. So what your body will do? It will break down the stored fat from the body. More amount of what? What acetoacetate production, ketone bodies production. That will come out in the urine as well, right? So now another question comes, if a person is on a keto diet for last 2 months, listen the question properly. If a person is on keto diet for last 2 months, and another person is on keto diet for last 2 days. Whoever is talking, don't talk. If a person is on keto diet for last 2 months and another person is on keto diet freshly, who is talking? And another person is on keto. Okay, listen the question. If a person is on keto diet for last 2 months and another person is on keto diet since 2 days, both should have presence of ketone bodies in the, this is in the urine dip. If we do the dipstick test, both should have, right, because both are on keto diets, but both will not have. 2 days वाले में ज़्यादा होगा. हाँ, why?
Because his body is not used to it.
Yes, he is not used to it. And the person who is doing it for 2 months, body adjusted, exactly. Good. This is the logic. Someone who is on keto diet for a prolonged period, his body has adapted to it. His body adjusted to it accordingly. The body understood the routine. But the person who suddenly started it, his body did not get adjusted to it. So that's why his sample will have ketone bodies. Okay. Now question answers. These are the types of questions we will be asked in the Viva. Already discussing the answers. Okay. Now who will answer, name the ketone bodies? Who can raise your hand? Say. Acetone. And beta butyrate. Yes. Now which ketone bodies do not give Rothera's test positive? You tell. Hey, don't utter. You tell. Which test does not give positive for Rothera's? Wait, don't murmur. I know you. This part knows. Good. Sit. Now, what is the cause of ketonuria without elevation of blood sugar? What is the cause of ketonuria? Means what? Urine में ketone without elevation of blood sugar. Huh? Low carbs. Who is saying starvation? Starvation. You're saying yes, starvation. Now in Rothera's test, what is the importance of ammonium sulfate? What? You only you. No, it does not. It's wrong. What makes it alkaline? Liker ammonia makes it alkaline. So what this ammonia sulfate does? Exactly. It clears the urine, the proteins and other byproducts for the reaction to take place. What is the sensitivity and specificity of Rothera's test in diagnosing ketoacidosis? Okay, wait, I'll ask one by one. You. वो सारे आते थे, ये वाला नहीं आता. You should learn. Tell me, what is sensitivity of the test?
Exact amount.
English. Try in English. You cannot speak in front of external in Hindi.
You cannot tell that whether the ketone bodies are. It may be in little amount, but
traceable amount. Yes.
It cannot tell exact.
The exact. Even if it is negative, also the test is negative. Ketone bodies may be present in traceable amount. Yes. Now sit down. Now tell me the specificity. Tell. Yeah. Tell. Stand up. Specificity. No. Yeah, ketone bodies, not particularly the byproducts. It is positive for ketone bodies. How will be the urine smell in ketone smell if ketone bodies are present in urine? Sweet, fruity. How will the breath of the patient smell in case of DKA? Huh? What? Maggie smell. Somebody said Maggie smell? How will it smell? Yeah. Sweet and fruity. Yes. Why? Presence of ketone bodies. Which ketone body particularly? No. Acetone. We call it acetonic breath. In medical, when you'll practice, you'll acetonic breath. Yeah, that's what they say. Okay, because of the presence of acetone, the smell is this fruity smell we get. What makes the medium alkaline? Nobody will answer. Nobody will answer. Nobody will answer. No. What makes the medium alkaline in Rothera's test? You tell. Yes. Do you want to note the questions? Yes. Okay, do it. See, the color is better now. You want to see? If you give some time, see the junction between the urine and liquor ammonia. You can see the difference better now. Okay, do fast because you have to perform practicals now. And when you go in the practicals, don't give blank faces. I am saying again and again. Yes.